Yes. So get ready, get ready, get ready. Rapid fire round. Yes. Reading session, rapid fire round. Reading session, rapid fire round. Yes. And the topic is topic. Topic. Topic of the day. What is the topic of the day? Topic of the day is fractures, dislocations, and sprains. Topic of the day, fractures, dislocations, and sprains. Insert. Fracture. Dislocation. Sprains. Hospital. Fractures, dislocations, and sprain. Check identify one. Fracture, dislocation, and sprain. Fractures, X-ray. Fractures, dislocations, and sprain. One we can take, no problem. Okay, which is the best possible option? No way. What is this? This is yeah, I got it. Yeah. Okay, fractures, dislocations, and sprains. Yes, fractures, dislocations, and sprains. Right. So this is the topic of the day. Authentic test. We are going to do a very fast round because it is rapid fire round. I will not allow anybody to unmute, but I'll give you a chance to write. I'll give you a chance to write in the chat box. Okay. When I ask you a question, you write immediately. I will not look at it. But when I tell you something Okay, everyone can think what you are, whether you are right or you're wrong, how others are responding, how you are responding. Okay, which answer may be right, why those people wrote that answer, why these people wrote this answer, like that. Hide, float, enable, annotation, no. Live stream. Live stream is already there. Okay. Hide, floating. Yeah. So this is the topic of the day. Yeah. Topic of the day. And the question is here. So these are all the audios which you have done today. Yesterday, sorry. Yes. Yes. Okay. Test one, yes. Reading one, yes. Whenever I give lecture, automatically be there. This is reading test. Official, authentic materials. I will write, then it is, you can take it for granted. That means reading test, official, authentic materials. These are official materials. You can blindly take them. That's all. Because these are OET official website materials. So blindly take them. You can no doubt regarding this. Do whatever you want with these things. Yes. Now, right. Now I'm going to ask you one question in the chat box. Yeah, what the question is, do you want to feel the heat? Do you want to feel the heat? Do you want to feel the heat? Because this is rapid fire round. Say yes or no. If you say yes, I'm going to show you some magic. If you say no, then I'll be normal. You want to feel the magic, you want to feel the heat. Say yes, sir. Because this is a serious batch, intensive batch. You know that. Intensive batch. So intensive batch. Those are really having that desire, burning desire, attend every session. Though you are registered for morning session or afternoon session or evening session, you can attend each and every session, no problem. And who is this Oppo? Please, Oppo, type your name or change your name because I don't know any Oppo. So, right. So you can type your name so that I can change. Otherwise, you can rename because I gave you permission to rename. Oppo. More. Okay, rename. Name. Okay. So name, please. How to do this? Cancel. Okay, message chat. Name, please. Name, please. Yeah, please. I'll be very happy if you can just type your name, because we're going to a serious session. I cannot call you like a Samsung or a iPhone or Oppo or some other name. So, right. Very good. Thank you. The name is Sinimol. Simimol Ajo or Simimol Augustine. Sinimol is Augustine. Simimol is Ajo. So, right. All are moles only. So, rename Simimol. Check Simimol Augustine or Simimol Ajo. Simimol. She has written, I think, here. Simimol Augustine. Not Sinimol, Simimol. Simimol Ajo, I think. AJ. Simimol Ajo, right. Yeah. So write two names like this, better. If you write two names, no confusion, because there is one Sinimol, there is one Simimol. Okay, so confusion should be avoided. Yes, Simimola Joe. Very good. Right. And there is another one come now. iPhone, Abu. I just told iPhone has come. Okay, name please. My dear children, please name. Okay, iPhone's name. Name, please. Two names, it is better. One name at least. You can write in the chat box or write here. Name, please. Yeah. Because I cannot call you as iPhone. It's very bad to call you as iPhone. So, right. And God has given you a wonderful name, I have to call you by your name. That's the reason why. Okay, the topic of the day is fractures, dislocations, and sprains. Fractures, dislocations, and sprains. That is the topic of the day. Okay. And then we are moving ahead. To the text. Here we are. Yeah. Now I'm going to show you what you have to do. Okay, just to see like this. Don't see too much. 180 full screen. Yeah, that is enough. Yeah, that is enough. So now what you are supposed to do is, let us see here. Fractures, dislocations, and sprains. So here you are making it colorful. Okay, that is it. That means you are underlining these things. We are going very fast, okay? We are going very fast. This is called the main door of the house. This is a house. There are 4 rooms. Text A is one room. Text B is another room. Text C is another room. Text D is another room. So there are 4 rooms. And the name of the house is Peter's house. Peter's house, Peter's kitchen, Peter's bedroom, Peter's dining hall, Peter's living room, like that. So 4 rooms of Peter's house. In the same way, fractures, dislocations, and sprains in the main door. Once we cross the main door, we'll go inside and we'll find different rooms. And in the first room is about fractures, dislocations, sprains. That's all. So fractures, dislocations, and sprains are 3 different type of outcomes when you fall down. When you fall down, you may get a fracture or you may get a dislocation. There may be a dislocation or you may have a sprain. So fractures and dislocation and sprains are 3 different outcomes when you fall down. So that is maybe if you break your bone, it is a fracture. If the bone is misplaced, it is called dislocation. If the nerve or the skin gets ruptured and you get a sprain. So sprain means pain. Okay. Pain means, sprain means little painful. And dislocation means location changed. Okay, there is no bone fracture, there is no sprain. And fracture means it's not dislocated, but it broke totally. Okay, not just painful, it broke. Okay, so that's it. First one is serious, second one is moderate, third one is simple. Simple, moderate, serious problems when you fall down. So these are the 3 different types. So you can say types. So categories. 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 Come on. What are the synonyms of categories? Come on, fast. Write down. What are the synonyms of category? Write down in the chat box, fast. I'm giving you just 10 seconds or 15 seconds, maybe 30 seconds. Come on, write down all the words which are related to categories. Okay. iPhone left it. Don't you want to reveal the name? Okay, no problem. Okay. Categories, divisions, departments, areas, types, classes, classification. Okay. Compartments, areas, groups, denominations, divisions, types, kinds, divisions, departments, groups, compartments, categories, areas, divisions, classifications. Okay, come on, fast. We don't have time. We don't have time. All the time in the world we don't have. We're just 15 minutes. That's all. 15 minutes. Next one. Okay. Now here the next one is here. So immediate management, simple fracture of limbs. Simple fracture of limbs. Okay. Right. Okay. Fine. So simple fracture. Okay, fine. Closing it up. Yes. Simple fracture. Simple fracture. If this is simple fracture, then there is serious fracture somewhere else. Simple means ordinary. Means somewhere extraordinary fracture. Okay, serious fracture. So immediate management, clinical assessment, then you have management. Management, assessment, and management. So this is management. Management, simple management. Simple and management. Simple and management. So immediate management, clinical management, that means before going to clinic, then after reaching clinic, and after coming out of clinic. Okay. So, right. So here, so this is before doctor. First one is before doctor, immediate management, before reaching doctor. Then it is doctor. Then this is after doctor, pre-doctor, while doctor, post-doctor. Clinical means in the doctor. In the clinic, doctor. Before clinic, after clinic. After clinic assessment is done, then management will be started. So these are the three things. So this you can say as simple management or just management. Okay. Again, just to say management, two types management is there. So management. That's it. So this is management of fractures. Then next one, don't do anything else. Don't do anything else. Okay, then this is drug therapy protocol. Drug therapy protocol. Drug means what? Drug or therapy means treatment. Okay, drug. Okay, medicines. So all these are related to drugs. Okay, all these are related to drugs. Drugs means medication. Drugs means medication. Medication. So third one is medication. So this room name is medication. This is already into medication. So if here is adult, then definitely children also will be there. So be careful. Then next one, technique for plaster backslap. This is serious. This is serious management. That is simple management. Simple management, just management. And this is serious management. That is plaster. Plaster. Or you can say backslap, whatever you want to say. Okay. Backslap, whichever is best you can say. So this is not simple. Not simple. It is serious, problematic. Backslap. So anyone you can take. Backslap. Okay. So these are the four different things you can take. These are the four different things you can take. Okay, plaster, backslap, you can see here. Plaster, backslap. Okay, for arm and leg fractures. This is for fracture. Those are simple fractures. These are serious fractures. This is with back slab, that is without back slab. So that is simple fracture. So without back slab, this is serious serious fracture. So plaster back slab. So both are fractures. So plaster for fracture, that is no plaster, just management for fracture. So you can understand. So this is just management. Is also fracture, simple fracture. You can see a simple. That means this is compound fractures or serious fractures. So now we have got the 4 words. 4 words. That's it. 4 words we got. So what are the 4 words now? You know very clearly. The 4 words are, first one is categories. First one is categories. And the second one is management. Third one is medication. Fourth one is back slab. Fine. Okay. Open fractures, dislocations, and sprains. Yes. So now let us see here. Fractures, dislocations, and sprains. Okay. Yeah. So here we have fractures, dislocations, and sprains. Fractures, dislocations, and sprains. Okay, now let us see. I'll be asking you some questions. I'll be asking you some questions. Take your notebook and write in that one answers. Okay. Now this is fractures, dislocation, and sprain, right? Right. Fractures, dislocations, and sprains. Very good. Now this is categories. Then you have fractures, dislocation, and sprain in categories. That's why it is categories. Then simple fracture of limbs. This is text B. Text B. And second one is clinical assessment. The second part of text B. Then next one is third part of text B is third one. Okay, management, simple management. Third one, management 3. Third part. This is examine. Assess, examine. And next one is management. Okay, this is fourth. So 4 slides. In part A, you can see here. So part A is only one. Text A is only one. Fractures, dislocation, sprain. Text B, simple fracture of limbs. This is first slide. This is clinical assessment, second slide. This is examine, third slide. And this is management, fourth slide. That's all. So I think you are clear with this one. Right. So 1, 2, 3, and 1, 2, 3, and 4. Okay, fine. Next, text C, drug therapy protocol. Table I gave in the next paragraph. Table I gave in the next page. Yeah, this is medication only. Table I'll give in the next page because I wanted it to be separate. So big size, that's why. So this is medication, text C, 2 slides. Okay, medication. Third one is medication. And fourth one is plaster backslab, print screen. Okay, now I am going to ask you some things. Yes. Okay, this is Libin. Right, everyone in the meeting. Okay, fine. Now let us see here. Now, so get ready. Take your notebooks, pencils ready. I'm going to shoot you questions. Right. Don't write anything in the tab until I tell you. Okay. Chat box. Don't write here anything. Right. Fine. Now we are moving to the next stage. Now question. So in which text can you find information about question? So question will be in between. So A is categories, B is management, C is medication, D is backslap. So this is same for everything. Only the question part, question will come. Okay. Only the question part, question will come. Okay. Is that clear? Say yes if it is clear. Say yes if it is clear. Come on, fast. We don't have time. Just 10 seconds. Because we are doing the test now. Without reading anything. Without reading anything, we are going to do. Yes. Fine. You are ready for the challenge then. Yes, get ready. Height floating meetings. Yeah, this is the format. This will be the same for everything. Text A is categories, text B is management, text C is medication, text D is backslap. Yes, print a screen. Okay, now question 1. Just write in your notebook. In which text can you find information about procedures for delivering pain relief? Okay, pain relief. In which text can you find information about procedures delivering pain relief? A, categories, B, management, C, medication, D, backslap. What is pain relief? You should know. Okay. Yes, just write down in your notebook. First, number 1 and write down the answer. Number 1 and write down the answer. A or B or C or D. Don't write anything else. Write A or B or C or D. Now what you do is, yes, question 001. Yes, now type here fast. Type here your option A, B, C, D. 5, 4, 3, 2, 1, submit. I'll count down from 5. So you have to type the digits. Yes. Okay, fine. Very good. That's good. Excellent. Now let me explain you this question. Come on, fast. Sorry. Yeah. So finished everyone? Yes. 10 seconds. More. 10 seconds more. Yes, now I am going to give you the answer for this. If it is right, then tick in your notes. No need to do anything here. No need to do anything here. If it is right, tick in your notes. That's all. Okay, fine. Yes, reading sample test. What is this? Okay, this is answer key. Okay. I'm going to show you the answers. Oh. Page number 1, page number 2. Okay. Yes. Reading subtest. Part A questions. Okay. Part A questions. Okay, first answer. Yes, check it out. Check it out. Abracadabra. The answer is C. Answer is C. You provide medication for pain relief. You provide medication for pain relief. That's all. You provide medication for pain relief. That's it. Okay. If it is right, put a tick in the. So print a screen. Question number 1. Okay. So now you have to answer there. Okay. That's so simple as that. A or B or C or D. That's it. So you got the answer. Next, second question. Second question is here. The procedure to follow when splinting a fractured limb. Splinting a fractured limb. The procedure to follow when splinting a fractured limb. Fractured limb. Okay, write in your notebook first. Don't write the answer before I tell, please. Okay, because I'll have to put the number. Then only you have to say. Then I'll count. Then I'll count. Then you will say 5, 4, 3, 2, 1. Then. So those who answered before will not be counted. Question number 2. I will tell you, then you have to write. First write in your notebook. Don't be fast. We have to be together. We have to work together. Please. Okay. So that everyone will not know what you are writing. Everyone will tuck their post. Okay, fine. The procedure to follow when splinting a fractured limb. Fracture. Is it in categories or management or medication or back slap? So there is a confusion. In 2 areas you can see fracture. So which fracture? Splinting is which one? So like that. Okay, is it okay? Fine. Now 5, 4, 3, 2, 1. Submit. Come on, submit your answer fast. Okay. We don't have much time. We don't want to waste time. Okay. Next. Hide floating meetings. Okay. Next question is here. What to record when assessing a patient? Assessing. What to record when assessing a patient? Is it in the categories or management or medication or back slap? Okay. What in which one? Write the answer in your notebook. Question 003. Yes, write the answer in your notebook. When I count as 5, 4, then you have to. So you have to write the answer in your notebook. Yeah. Third question. Yes. A, B, C, D. Yes, 5, 4, 3, 2, 1, and submit. You can type and keep your answers ready. Yeah. Now, let us check the answer. Second answer. The second answer is 1C. Second is D. If D is your answer, put a tick mark. To put a tick mark in your notebook if D is correct. Just no need to read the passage. Okay, no need to read the passage. Next, third one is B. If B is the right answer, tick in your answer sheet. Tick in your notebook. Right. Next, fourth one. Okay. The terms used to describe different types of fractures. Types of fractures. Categories, management, medication, backslap. Okay. So 4 options are there. Write in your notes, please, first. Write in your notes, please, first. So question 004. Okay. Write in your notebook first. Write in your notebook first. So 5, 4, 3, 2, 1, submit. Submit your answer. Very good, very good, very good, very good, very good. Fine. So this is fourth question. This is fourth question. Fine. Print screen. Fourth question. Fourth question. Okay. Then, okay, print screen. Okay, fine. Fourth question. Let us see the answer for this fourth question. Types means categories. That's all. You should know the synonyms. I'm not crazy, nor you are crazy. No one is crazy. Okay, we are not insane. If we know the synonyms, answers are clear. So try to realize that. Try to realize that. No need to read anything. Reading is nonsense. I'm not joking. I'm telling the fact. That is called the technique. Okay, that is called the strategies. Everyone wants techniques, tips, but no one wants to attend the lecture to learn the tips. They only want to learn the tips without learning the tips. Okay, just like ready to use, huh? Ready to eat like. They don't want to learn. They don't want to cook pizza. They want to just eat pizza. We are not a fast food vending machine. Remember that. So next, fifth question. The practitioners who administer analgesia, the practitioners who administer analgesia, categories, management, medication, or backslap. Categories, management, medication, or backslap. Question 005. Question 005. Yes. So you have the choice here now. You have the choice here. The practitioners who administer analgesia. Write in your notebook first. Write in your notebook first. Okay, write it. Okay. Now 5, 4, 3, 2, 1, and submit. Yes, come on, submit. Submit. Okay. Yes, next we are moving to question number. Yeah, we are moving to question number 6. We are moving to question number 6. Okay. Question number 6 is here. Yeah. What to look for when checking an injury? Checking an injury. So checking. First one is types. Out of accidents. Second one is management. Simple accidents. Third one is medications. After accidents. Fourth one is management or backslap after accident. If something breaks. If something doesn't break, D. If something breaks, D. Remember that. First one, different types. Second one, no breaking. Okay. Third one, medication. Fourth one, break is there. Breaking of bones. Okay, fine. Remember that. So now, 5, 4, 3, 2, 1, submit. Submit. Submit, 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 submit. Be active. Don't be sleeping. Don't be sleeping. A live dog is a lot greater than a dead lion. A live dog is far powerful than a dead lion. We are live dogs, not dead lions. Okay. Okay, fine. Very good. So checking, the word is checking. Operating word is checking. Okay, if you understand this one, it will be easy for you. So next, seventh one. Seventh one. So seventh one. So question number 7 next. Question 007. Question number 7. Question number 7. So now let us see how fractures can be caused. How fractures can be caused. How fractures can be caused. Causes. Different causes. Different causes result in different type of fractures. Different causes result in different type of fractures. If this is the cause, this fracture. If this is the cause, this type of fracture. So like that. So try to understand. There is read between the lines. How fractures can be caused. That means fractures. Different fractures can be caused. Okay. Joint fractures, bone fractures, okay, or arm fractures, leg fractures, okay, or different fractures. How fractures can be caused, okay, causes. Okay, if one cause, this fracture. If another cause, no fracture but only sprain. If another cause, then there may be dislocation, like that. So you read between the lines. So 5, 4, 3, 2, 1, and submit. Okay. So very good, very good. Now let us see the answers. So this is fourth one is A. Tick your mark. Okay. This is number 1. Print a screen. Number 1. Number 1. Number 1. Sorry. Okay. Number 1 is here. So here's number 1 is C. Okay. Number 2. Okay. Number 2. Number 2 answer. Okay. Then number 3. Question number 3. Question number 3 is B. Okay. Okay, print the screen. Question number 3 is B. Okay. Question number 4. Question number 4. Question number 4 is A. Okay. Question number 5. Print the screen. Question number 5. C. Question number 6. Okay. Question number 6. Okay. Is B. And question number 7. Okay. Print screen 7A. Okay. Right. Good evening, Raki. Okay, so total score out of 7. Okay, total score out of 7. Type and keep it. Type and keep it 3 by 4, 3 by 7, 5 by 6, or 1 by 4, whatever you are number of answers you have done based on that one. Total score out of 7. Type and keep it ready. Type and keep it ready. That's all. Type and keep it ready. Okay. Type and keep it ready. Yes. Yes. 7, 6, 5, 4, 3, 2, 1, submit. Regimol, how can you get 7 marks out of 6, Regimol? It should be 6 out of 7, Regimol. Type again, Regimol. Type again, 6 out of 7, total 7, out of that 6 you got. Type the answer again, no problem. In your confusion or your speed, you have written like that, no problem. Don't be angry with me and don't be upset with me. So, I told you it's a rapid fire round. I told you it's a rapid fire round. That's all. Okay. Yes. Unmuting everyone. One by one, you share your experience. Okay. One by one, you share your experience. Okay. First question. First question is, without reading, answering, technique versus technique versus technique versus blind rush. Okay, traditional technique versus blind rush. Okay, now experience. How did you feel? Come on, write out your sentences. Whatever you want to write, you write. Whatever you want to write, write. Whatever you want to write, you can write. Like the small child, no? How happy he is or she is. I don't know whether he or she. I cannot identify very clearly. Children are very smart, very clear. So with the dimple on her cheek or his cheek, see, very nice. Like that your faces should be when you do these things. Okay, right. Write down your points. Whatever you want to write, you write. Envy Jacob. Number 1. Let us start with Envy Jacob. Envy Jacob.
Yes, sir.
Envy Jacob. Yes, share your experience. Envy.
Yeah, it was very easy to find out, with this technique.
Okay, right. So earlier, how you used to do, and is this different or something like that? Share your experience.
Before it was taking little more time to skim and scan and to confirm again with the text and with the questions. But now with the headings itself, when we can identify, sir.
Yeah, heading means head. If the head is tiger, how can the body be cat? That's the point. If head is head is tiger, that means entire body is tiger. Finished. So that's it. So by that one, it will be very clear for you. That's all. No other option. Next one. Galaxy. I don't know who this Galaxy is. I cannot call them by name. So Galaxy, do you want to unmute and speak something? Okay. Yes. Yes. Write down your name, Galaxy, or open and speak. Yes. Galaxy. Somebody has written here. It makes it easier to answer the question. Yeah. Galaxy. Who is that Galaxy? Okay, fine. Greta, share your experience first.
It was good experience, sir. Able to find the answer without reading the passage.
Right. Very good. So were you able to find the answers easily or with great difficulty?
It's easy, sir.
With synonyms,
So
you
can
have to learn. You have to learn the synonyms, meanings.
yes, sir.
Okay, so learn the meanings and synonyms. Okay, great. Linda. Okay, Linda, share your experience, Linda.
So the technique is very good and it makes it easy since we have limited time to answer those questions. So it makes it very easy to answer the questions.
So, did you register with the right teacher?
You, sir?
Are you happy that you registered with the right teacher or a time-wasting teacher?
I'm happy. I'm happy.
Very good. You are from Nigeria, and I have number of students from Nigeria. Actually, these students, they like me very much, you know. They refer my name to other friends also. Right. Next, Malika. Hello, Malika. Punita.
Sir, good afternoon, sir.
Good afternoon, Punita. How are you?
Fine, sir. Thank you, sir. How are
Yeah, I
you,
missed you, Punita, for some days. Where
Yes,
did
sir.
you
I'm
go?
because I am not feeling well.
Okay,
Now I
no
am
problem. No problem. Take care of your health, okay?
okay, sir. Okay, sir.
Yeah, how was that? Was it useful for you?
Yes, sir. Very useful, sir. It's very nice experience. Earlier I was reading heap A part, A, B, then again it's going and checking the question. Again I'm reading the text. Like that I am finding the answer. Now I am easily I find the answers. All the
If
answer
20
I find here.
questions are there, 20 questions, you can find answers like that first. So then second step, for all the 20 questions, you have to do this technique, okay? Not only for first
Okay.
7.
Okay,
Not
sir.
only
Okay,
for
sir.
first 7, for all the 20 questions, you have to do like this.
Okay, sir. Okay, sir. It's a very
Then
nice
second step
experience.
will come. Then the second step. For
Okay,
the
sir. Okay.
8, question number 8 to 15, there are 2 steps. This step and another step. For question
Okay,
number
sir.
16 to 20, there are 3 steps. Okay.
Yes, sir. Yes.
Yes. Okay, fine.
Thank you, sir. Thank you very much.
Yeah.
Good evening,
Ram?
sir.
Yes.
Good evening, sir. I am
Good
Malika
evening,
here.
Malika, how are you?
I am fine, thank you, sir.
Yes. Tell me, share your experience, Malika.
Yeah, my experience was excellent, sir. It was crystal clear for me.
Oh, you are new student, no? This batch you joined, right?
Yeah.
Okay. Welcome for the sessions. Yeah. Share your experience.
Yes,
What is
sir.
the difference?
Yeah.
Earlier, did you attend any sessions with anyone? And don't take the names of institutions and teachers. Just tell the
Yeah.
difference in experience.
Yeah, I have attended before earlier for another institution, but it was not that much clear for me. But today I catch up with your techniques. It was very nice and excellent, sir. Now I can able to do within 13 minutes. I hope so.
Okay. You should not say can able. Can and able both are same.
Yes,
Okay.
sir.
I can do it or I am
Do it.
able to do it.
I am
Okay?
able to do it. Yes, sir.
Okay, you
Thank
can say can. I can do it or I am able to do it. Can and able
Okay.
both will not come together because they mean the same. Okay.
Okay,
Next,
sir. Thank you so much.
Cinemol.
Thank you so much, sir.
Okay, Regimol.
Yes, sir. Yes,
Yes,
sir. It
anyone.
is very nice experience, sir.
You are also new student, right?
Yes,
This is your first class in reading, right?
yes, first class.
Are you happy with the clarification?
Yes, really.
Now, don't do test every day. Try to learn like this every day. Then in that Saturday, you do mock test. That will be beneficial. Okay.
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 Yes.
Okay. Next, Cinemol.
Yes, sir.
Yeah, share your experience, Cinemol.
Sir, like I said earlier, this was a good experience. And today I was doing something differently rather than you said. But today I learned the technique that I will apply on the next.
Oh, you are
reading.
Cinemol, who has registered only for reading, right? Paying 3,000, correct?
No, sir. I am
You are
Cinemol Augustine.
Cinemol Ajo. Okay. You have okay. Cinemol
Augustine.
Augustine also is there. Cinemol Ajo also is there. Okay, fine. There is one Cinemol, but she registered only for reading. Okay, fine. Because she says it's very tough, sir. Okay. So you share. Tell what is the difference you learned today?
Sir, I learned whatever the technique I learned, it is different because I in the part A, we are just checking the headings, and with the headings only we are able to find the answer. That is did earlier, but I was finding the difficulty when finding the answers. So sometimes the answers will be wrong, even after the predicting the answers, questions with the answers. But today I find a different technique with your class. I think it
Very
will be
good.
effective.
Very good, very good, very good. So, fine, that's fine. And anybody else is there? Galaxy. Galaxy, if you want to speak, you can speak. Okay, otherwise it's an end of a session. And we'll meet again. We'll meet again. What is the time now? The time is, okay. The time is 4:30. Okay, we'll meet after half an hour, 5 o'clock. We'll meet at 5 o'clock, half an hour. I'll take a little rest. Then 5 o'clock we'll start. 5 o'clock we'll do writing task. How many of you are ready for writing task? Okay, ready for a writing task. So say yes here in the chat box. Say yes in the chat box. Ready for a writing task. So say yes in the writing task. Okay, fine. Okay.
Time ಆಯ್ತಿಲ್ಲ.
Okay, then we are calling it a day. Not a day, we are calling it a break. Select all, Control C. Fine. Right. Okay, have a nice time. Half an hour back.